radiography also. So the topic is going to be about remote patient monitoring and whether we should implement it just because we have a COVID pandemic or whether it has potential for future applications. So the content of my presentation is going to be about the impact of COVID-19 had on the healthcare system. So some potential of digital health technology that we can use for facilitating remote patient monitoring. I mean, this topic is a very broad topic, so I'm just going to mention some examples for cancer patients and heart patients because these are the most common conditions. And then the last question is the future, so where do we go from here? So probably, as you all probably are now aware, so COVID-19 is a new virus that originated in 2019. And both COVID-19 and seasonal influenza have some similarities. So they are both transmitted from person to person via respiratory droplets or aerosols. And have also similar symptoms, so starting from fever, cough, fatigue, but can also get severe, which can lead also to pneumonia, and also in some severe cases also death. But how does COVID-19 differ from influenza? First of all, it's a new virus, so we don't have any immunity for it. We do not yet have any antiviral medications or vaccine available to treat, and is actually even more contagious than the seasonal influenza. So this is something that's going to have a big impact on our healthcare systems. So who was mostly at risk? So people aged 60 years and older are the ones that are mostly at risk. If they are living in long-term facilities, they also have a higher risk because in this area the disease can be transmitted more rapidly. But also if the patients have underlying health conditions such as hypertension, diabetes, other cardiovascular disease, or a weakened immune system, such as in the case of cancer patients, then the risk gets higher, which is a concern for us because these are the patients that very often are going to need hospital care, not for COVID-related issues, but to manage their disease, their chronic disease. If we had to compare the mortality from COVID when compared with others, so this is some data from the US. So at the moment, worldwide, we have about 59.4 million confirmed cases, and this has caused about 1.4 million deaths. So the mortality rate, it is a debatable topic, is around 3 to 4%, according to the data I found from the World Health Organization. However, when we compare the mortality with other causes, I mean, the mortality is still quite low, but because we have a lot of patients coming in at a rapid time, then this tends to overwhelm the healthcare system. So if we look at the data from the US, heart disease and cancer are still the most common causes of mortality. There was only a short time when actually COVID have exceeded that, while influenza tends to be a high cause of mortality, but is definitely lower than COVID and heart disease and cancer. So this is where it all came along. So we don't have a treatment, so the only way to manage it at the moment is to try to prevent people from getting it. And the only way to do that is via social distancing. So lots of recommendations, which I'm sure you are familiar with. We have to stay far apart, 2 meters apart. We have to wear masks. And the idea behind this is that we are not going to kill the virus, but the idea is to slow it down the spreading, so that we allow healthcare systems to cope. So it's actually more gradual. People are still going to get it, but they get it more gradually, but at least healthcare system can manage the loads from the disease. But if we look at healthcare systems, and this is actually what has sparked my idea for this topic, is that if you look at a typical outpatient room, emergency room, this is definitely not a place where you is designed to have social distancing. So they often tend to be crowded. You have multiple appointments going on at the same time, and this can become particularly of an issue, especially in cancer care. So we were discussing whether we should have between us students were, for example, participating for what we call a patient review. So this is sessions that occur after treatment where we check the patient side effects with a clinician and also a nurse. However, this of course comes with the issue if patients are going to come to hospital. Of course, then the risk of getting the virus is going to increase. And these are the patients that you are mostly vulnerable because very often due to chemotherapy treatment, they have immunosuppression. So we need to, first of all, start by managing the immediate challenge. And this is where digital health could potentially have an option. But first of all, we need to start off by setting priorities. So in the case of cancer care, because that's where my specialty is that various guidelines, particularly ESMO and other professional bodies, have issued guidelines on who should get treatment, so the high priority, so no matter what, we have to proceed with treatment. Those that have medium priority, so the ones that can afford to delay the treatment by 6 weeks. But if we delay by more, this could lead to worse clinical outcomes. And those patients that have a lower priority, such, for example, I'm thinking of a low-grade prostate cancer so this doesn't tend to spread rapidly, so we could wait until the pandemic has passed to start providing treatment. But this is going to create a problem here, because at some point we're going to have to treat these patients, and it's going to create a big backlog in our system. So at some point we're going to have difficulty coping with what we have not done over the past year. So I like to call, we have talked about a lot of waves throughout the summer months and related to COVID-19. But I think there is an invisible wave that people may not be seeing that is a collateral effect of this. So this is some data that I actually found from the BBC website, so maybe it may be a bit questionable as a result of source, but in the UK, an interesting thing that they are finding is that the mortality from number of diseases, including heart disease in male and certain cancer, is higher in 2020 when compared to the data found in 2018. Still early, because of course cancer is always on the increase and heart disease always on the increase year on year, but it may indicate that something is not quite right. So the first thing that comes in mind is that patients are afraid, and because they are afraid, they are not going to hospital, or they go to hospital when it is too late. But there could be another reason for this. To give an example for us radiographers, I think I'm also talking here in Malta, but also I found this in an IAEA website, is that a lot of diagnostic tests have been slowed down. And in particular, looking at, for example, myocardial scintigraphy, in all the countries, irrespective of how strong their healthcare systems are, they had to cut down on these tests as the the resources, healthcare resources, were directed to dealing with the pandemic. And of course, this means that what we used to detect before at an early stage, now it might be that we are detecting it too late. So this is where, in my opinion, digital health solution may help us to address some of the healthcare challenges that we may encounter. And so digital health is a very broad term that incorporates a lot of things. So it incorporates telemedicine, ranging from video conference, mobile health, wearable devices, and also use of data to analyze healthcare outcomes. So we'll explain and give some examples of this. So telemedicine is far from a new concept, but it's something that has been developed for quite some time. So basically, the simple context behind it is that it involves remote medical care and clinical healthcare service via live communication between healthcare providers or physicians and also the patient, irrespective of their location. So they can be done at home or it can be done anywhere. But it's actually the first form of telemedicine actually dates back to something as 1905, so where we had the first electrocardiograms that were being used to monitor patients remotely, patients who had heart disease. but then eventually it developed. So we moved to using this technique to provide care for people who are living in remote islands, or maybe if they are on ships, to transfer radiographic images. And eventually we started to have, in the 1950s, the first form of organized telemedicine. But in the 1950s, this was not very successful, mainly because of lack of funding for development of this program, but also I think the main problem here was the technology was not there. So we did not have the fast interconnections we have today, and the sensors we have today, and the computer technology was just inexistent. This, of course, have changed. Okay, so video conferencing, now it's quite the norm. So we had it for a long time, but I personally, as a lecturer, I really discovered its power as a result of COVID. And nowadays we have a number of systems, so we can use for video conferencing. You can use it to have a video conversation. So rather than using a dry phone call, we can actually talk to the patient and see the patient, and that can give us more information about how they are doing it without actually bringing them to the hospital. So you can use standard commercial systems such as Skype, Zoom, or there are actually some systems that are being designed specific for healthcare purposes. And locally, we also have a startup that they have taken up this opportunity. So the startup is tabib.mt. And they designed a simple mobile application that you just download, and a lot of doctors, but also not just doctors, physiotherapists and psychologists are now providing their service via this platform. So with it, you also have a payment system, because of course, when it comes to private healthcare, then the payment, of course, it is an issue. But video conference is just one tool that we could use, but perhaps it's the one that is the easiest available, because it doesn't require any particular extra costs. I mean, nowadays pretty much everyone has a mobile phone and everyone has a computer. Not everyone, but it's still much widely available. Another approach that's been around for quite some time is the use of mobile health. Okay, so here what we have is that we can use some things like questionnaires, simple questionnaires that are sent to the patient. So the patient fills up these questionnaires on their mobile device, and this goes back to the healthcare provider. And then, depending on the workflow you want to use in the hospital, you can do a number of things. So you can have some automated feedback to the patient, or you can have a healthcare provider that evaluates this data, and then based on that, they either bring the patient back to the hospital because they spot something that needs to be tackled, or they simply provide online advice. So the advantage of using this as a means of providing patient review is that you can have a longer data collection. So typically when our patients finish the radiotherapy and chemotherapy, the side effects are their worst, are their peak. And that is when the patient is actually left alone at home. So, okay, they can call, but a typical patient who doesn't know what is normal, doesn't know what to do, well, whether they are being a bit maybe too overreacting about it. So maybe they might not reach the healthcare professionals in time. And there's always a lag between your treatment and your actually first follow-up appointment. But having this regular questionnaires that maybe can be answered by the patient every 2 weeks, 3 weeks, may be done alone or maybe in conjunction with a GP or maybe another person that can assist them with that, then they can actually pick up side effects that are abnormal at an earlier point in time. And if there is a need, then we bring the patient earlier for review. But if there is no need, the side effects are within range, then we can actually reduce the need for patients coming to hospital and reduce the risk of spreading infections. So the potential benefits are quite enormous. So reducing the risk of acquiring infections in immunocompromised patients. So this does not just apply for COVID, because hospital-acquired infections are a major issue all the time. Okay, so we don't just have COVID. Remember, I also have MRSA and all sorts of other infections that we would like to avoid getting. But also has additional benefits such as no need for traveling or taking time off to get to medical appointments. Hospitals are always running out of space, so maybe instead of having spaces dedicated to outpatient does not mean that you eliminate it, but it will reduce the need for it. So, and then that space can be used for example, implementing diagnostic tests. We can also use it to meet multiple professionals at the same time. So rather than having an appointment with the surgeon and then another one with the nurse and then another one with the oncologist, I think because then you are not so dependent on location, then this appointment can be managed within the same session. So it's easier to have multidisciplinary discussions. Increased efficiency, so problems can be identified before the next follow-up. And then you also only bring the patients that need it. So then with the patient that need it, you can dedicate more time and treat more effectively. Can be used to facilitate identification of sensitive psychosocial issues. So for example, if we take the example of prostate cancer, where, for example, sexual health can be an issue. So some patients may not be willing to disclose this immediately, but they might be willing to disclose this within a questionnaire, and then the oncologist can pick up on that and see how best to manage this. But however, this can also act the other way around as well, because maybe some patients may not feel more comfortable disclosing psychosocial issues within in person because it's a sensitive issue. But I think a very important benefit of this is that it facilitates the collection of structured clinical outcome data. And this is why a lot of now clinical trials are using what we call EPROMs. So EPROMs are electronic patient report outcome measures as part of their ways to assess their effectiveness of a new drug or a new medication. However, it does not come without its challenges. So the main challenge is the technology. I don't think the issue is availability because, again, if the patient does not have a mobile phone, I'm sure some of the relatives will have a mobile phone and then can assist. But there is also the issue with the ease of use and also accepting the technology. Internet connection sometimes, of course, lets us down, so that can become a problem. There's also issues with compatibility. So, for example, in installing a healthcare app, it might not work on all mobile phones. Data privacy and security, providing the emotional care, and sometimes the needed hug to a patient. But also there's the issue of performing certain diagnostic tests. But to some extent, we are now also have some techniques that we can use to address the later challenge. Well, I think you all have seen those watches, so maybe some of you already have that. So with remote patient monitoring, we can have a number of sensors that can be used to record and send data about various physiological parameters. So these sensors can be non-invasive, such as a wearable sensor. So these watches are a typical example. And you can measure a number of things, so temperature, blood pressure, glucose, oxygen. So you can already probably start seeing how we can use this. So if I have a patient who had chemotherapy and they develop temperature, this could send an alert to the oncologist, like, okay, why is the patient having temperature? And then they can contact the patient to see what's going on. Another a bit more invasive are the implantable devices. So the one which is most commonly used for a number of years is the implantable defibrillators that are used to monitor heart. If there is a heart irregularity, then the defibrillator can kick in and provide the necessary support. The sensors can also be active or passive. So some sensors do not require any user input apart from wearing the device, but some sensors would require deactivation. So, for example, you would need to instruct the sensor to take the blood pressure. And the advantage of this that is going to facilitate the collection of a longitudinal objective clinical data. So now this is going to link us back to how are we going to manage cardiac patients, so patients who have heart disease. Sometimes doing the one ECG will not be enough to pinpoint an issue. So, but if you have a more prolonged data, then you can have a better idea of maybe some issues that may be go under the weather in some cases. And it is not new, so it's already being used quite a lot. So this is some data from an Italian hospital. They found that using remote cardiac technologies for monitoring patients, you can actually reduce 30 to 35% mortality, but also hospitalization can go down from 15 to 28%. And this is what we can use now to address the backlog we're going to have, for example, in nuclear medicine, whereby we can use this as a triage to identify the patient that definitely need to be tested and to avoid having their tests too late. But of course, there are challenges in implementing remote patient monitoring. And I think the major challenge is not the technology. We have sensors, we have computer technology, we have networking, but it's how are you going to create a workflow that works. And also within the workflow, then we need to keep in mind that what happens if we have patient has something, is going to go to the cloud. How often are we going to monitor? So are we going to monitor 24/7? Is there a need to monitor 24/7? So, or can we afford, for example, to monitor side effects once a week or cardiac function once a week? And based on that, then what are you gonna do? Are you gonna send an ambulance if you have a certain threshold? Are you gonna form loved ones? The technology is there, but now we need to think, okay, but how can I use this effectively? You also need to think that the technology is not infallible, so it will at some point fail. And then if it fails, who's responsible? If the patient has a heart attack and the remote monitor was not working, and then who is responsible? Also, this generates an enormous amount of data. We do have algorithms that we can develop to manage the data, but they are not so specific for healthcare. So that is something that will require a lot of work. So, role of digital health in addressing future challenges. I think an important role is if we want to reduce the number of patients going to hospital, is we first of all need to tackle prevention. And thinking of heart disease and cancer, so a lot of it can be prevented, with one of the causes being smoking, poor diet, lack of exercise, and hypertension. So this is something probably a lot of you are already doing. So I personally use a watch to monitor my exercise, and I also use a diary to monitor how much I'm eating and trying to keep a healthy lifestyle. It doesn't mean that I commit to it all the time, but it is a way that helps me to improve my well-being. But apart from prevention, also, I think the power is going to be mostly integrated when you have, for example, mobile health technology integrated with your medical records, which at the moment is not yet fully there, but a lot of companies are realizing the potential. So what was initially just a simple startup company, so I can give the example of Elekta. So Elekta is the main manufacturer of radiotherapy equipment. They saw this potential and are now integrating a mobile health technology within their Mosaic system. And once you have that, then you can have much better support. So we can provide more personalized support and hence improve the quality of life of the patient. We have improved symptom management for care teams, and also I think the great potential is going to come after with what you can do with the data you collect, because then you can use that to monitor treatments, to provide more personalized therapies, but also to evaluate what we are doing. So for example, if we introduced a new technology, VMAT, MRT, But the question we need to ask, is it actually beneficial to the patient? Does it actually reduce side effects? And how are we going to know? We will never assess it. And this could provide a tool to better make use of healthcare resources. So at the end, we need to improve the idea of addressing the COVID-19 challenge, so both the immediate but also the collateral effect on it, is by improving the efficiency of healthcare system. I think something we need to keep in mind about the pandemic, that it had a major economic impact. So for the next few years, I think getting resources for healthcare, even though people are now more aware how healthcare important is, but it's going to be more difficult because simply the money is not going to be there. So the way to address it is that we need to make our healthcare system more efficient and more effective. And there are a number of potentials. So for digital health, so basically making the healthcare more accessible, more affordable, and also better quality. And you can use a number of systems ranging from telemedicine, ways of providing better education, monitoring, and linking this within the healthcare records to improve the quality of the care provided. So I think probably a lot of you are familiar with the TED Talk that was provided by Bill Gates, predicting that we are not prepared for a pandemic, and he was definitely right. And something that he also said about the pandemic, he also said that we have the technology to deal with it, but we're simply not putting it together. And I think this is going to be the key barrier in developing digital health solutions. And the issue is, how are you going to create a network between patients, healthcare professionals, information technology? Also, we need to address the legal issues, so issues related to security and privacy. So everyone is talking about the healthcare 4.0 revolution, the need of developing AI solutions, and how this is going to revolutionize healthcare. But in reality, the problem is not developing AI solutions. This technology is there already. The problem is, how are you going to create the bottom of the pyramid? So how are you going to create an efficient data collection system that you can use to learn from it, and then ultimately develop technology to create personalized patient care and also better, more effective treatments? So what we will be doing at the University of Malta to address this challenge, so this is our part. We need to address, for sure, education, research, and collaboration. And to do this, a first pit stop in our approach is going to start a master's in digital health. So the digital health will incorporate a number of lectures on all these topics we just mentioned. But I think the key point of it is going to encourage multidisciplinary collaboration. So I think as healthcare professionals, something which I struggled with personally a lot in my PhD was that I didn't have the healthcare IT skills. So I didn't know how to analyze data. I didn't know how to put networks together. And the idea of having this course where you have both healthcare professionals and IT healthcare professionals working together, then people can learn from each other. So the IT professionals can learn what we need in healthcare, and the healthcare professionals what we need. They can understand what they can do with the technology. And hopefully this will give rise to some at least small master projects that may be simple solutions that can address a particular challenge in a department. So for example, radiography or a number of other sectors. So to conclude, digital health technologies have a great potential in addressing the future challenges in healthcare, but they do also come with a lot of challenges. So it's not an so easy to implement. And I think we should not be afraid of the technology. We should exploit it, but we should exploit it wisely. So I think training and multidisciplinary collaboration are essential to address some of these challenges. So thank you for your attention. Please do forward any questions.